better feel for other components of the system. But like I said, today we are going to focus mainly on billing in the platform. What you're looking at in front of you is the practice management portion of drchrono. The practice management portion of the platform is meant to be used on a computer. Either a Mac or a PC is perfectly fine. It's entirely web-based, so as long as you have internet access, you're good to go with the practice management. In addition to the practice management, we have our apps on the iPad. We have our on-patient app that replaces the clipboard in the lobby of your office. You can use the on-patient app to have your patients check in. They can enter in their demographic information, their reasons for visit, things like that. In addition to the on-patient app, we have our EHR app. The EHR app is used for clinical note-taking, so that's the app that you're going to use as the provider when you're in the exam room with the patient to write your notes. And then we have our EMR app. The EMR app is actually meant to be used on the iPhone or the Android. You can use the EMR app to check your schedule, enter a patient's vitals, and process payments through Square and drchrono. So all of these apps and the practice management are really, really tightly integrated. And that's probably one of the greatest strengths of drchrono, is that all aspects of the drchrono platform were designed together with the intention for them to work together. So they really work together so seamlessly as a cohesive whole. Anytime you enter data into one of the apps or the practice management, it's going to be visible for you in some form or the other on the other parts of the platform. We're going to start today in the practice management by scheduling an appointment because everything in the platform is really tied to that appointment. So let's say a patient calls in and wants to schedule an appointment for today at 1 o'clock. All you do is click on 1 o'clock on that scheduler, and this appointment pop-up window opens up right here. If it's a new patient, you can click New Patient and start entering in their information. Or if it's a returning patient, all you need to do is start typing their name. So let's say it's Michelle Harris, a returning patient. Her name's going to appear in the drop-down menu, and you can easily select the patient. Then you can either go in and manually fill out information like the reason for visit, the date schedule, time schedule, duration of the appointment, or you can take advantage of the appointment profiles we have in the system and choose one of the appointment profiles you've already created. For example, I have an appointment profile for a vaccine visit, so I'm going to choose that, and all that information will auto-populate. Then I can also go into this notes box and type in any notes about the visit. Notes typed into this box are going to follow the appointment around, but they're not going to be included in the clinical notes. They're more for the reference of the office staff and the doctors. So maybe we want to say something like Michelle needs shots for a trip to Asia. So you know that, and the office staff knows that. The other thing you can do when scheduling this appointment is you can create appointment reminder profiles. So similar to those appointment profiles, these are for reminders. On the paid plans of drchrono, you can send out phone reminders, text message reminders, and email reminders to patients. And you can create different types of profiles for different types of patients or different visits. Another great habit to get into when scheduling that appointment is to record the patient's insurance information. You can do that by clicking on the pencil right next to their name. And when you click on that pencil, this window right here is going to open up. Then you can go into the insurance tab right here. It says primary insurance, and enter in the patient's insurance. So Michelle's a returning patient. We already have her insurance entered in there. If she was a new patient, all you'd have to do is type that in. Then you can scroll down and hit save and close. And once you've saved the appointment, you can go into this eligibility tab at the top and run a real-time insurance eligibility check to verify details about the plan and the deductible, so you can find out right off the bat if it's something that you can bill to. A really great tool to have. So we can find out all this type of information in just a matter of seconds. All right, so we've scheduled this appointment for Michelle. Let's say it's 1 o'clock now and Michelle's in the office. So for the purpose of this demo, we're going to assume Michelle has been onboarded. So she's gone to the front desk and she's used the on-patient app to check in. And now Michelle is in the exam room with the provider. So we're going to open up the EHR app because, like I said earlier, that's where the clinical notes are taken. In order to get into the app, the provider is going to have to enter in their passcode. And all of the appointments for the day are going to be listed over here on the left-hand side. We see that note that was associated with the visit right here. And then when we hit patient chart, we're going to be taken directly to the visit section of the EHR app. The visit section is where your clinical notes are created in drchrono, and they're created using our template system. So you can see these are some preset templates that have already come loaded into your account, and they're loaded into every drchrono account by default. You can use these preset templates as they are. You could also edit them and make them more specialized, or you also have the opportunity to create your own templates from scratch. So it's possible in drchrono to recreate all of your own forms within our templating system in our template builder. If you're interested in learning how to do that, we have a lot of videos online about it, and we also have Q&A sessions available Tuesdays and Thursdays. In addition to that, once you do upgrade to a paid plan, that's something that we help you with. As a paid member of drchrono, you get one-on-one support sessions and implementation sessions with our product specialists, and they help you build out your templates and your customizations. For the purpose of today's demo, we're actually just going to assume that Michelle has had her exam. So there's been information entered into these templates. She's been seen by the provider. And now we're going to go towards the end of the exam. So the provider is going to go into this billing tab right here. In the billing tab, you can see there's a ICD-9 section where the provider can go, and they can either enter in the ICD-9 code by the code itself or by the description. So let's go ahead and enter a code. We can choose that code right there from the drop down and add it to the list. We can also search for that diagnosis code by the description. So let's maybe look for like a streptococcal sore throat and enter that in there right there. The same is true for your CPT codes. So you can go in here and enter your procedure codes. So maybe it's like an office visit and you want to search for that. You can search and choose the CPT code. And then maybe we want to search by the actual code itself. So let's just try a code and we can choose an anesthesia. So it's very easy to enter your codes into the system. You can search for your HCPCS in the same way, or you can also create custom billing profiles. So custom billing profiles are bundles of your ICD-9 codes and CPT codes that you regularly use together. Rather than searching separately for your ICD-9 codes and your CPT codes, you can just create a custom billing profile that's going to auto-populate both when you select it. So it's just a way we save you time. Another way we can save you time in our billing center is through our pick list. You can create a pick list of all of your favorite codes or the codes you use most often, so that you don't have to search through the whole database of codes. It's much more smaller, a more condensed list. You can also enter in your modifiers here if you need to, quantity, diagnoses, pointers, anything like that. It can all be entered from the app. All right, so we've entered in some codes. In theory, Michelle has had her exam. Let's just go ahead and view the complete note so you'll see what that clinical note looks like. It's not going to have a lot of information in it because we didn't enter data into the other templates, but you'll still see some. So you can see we have some medications and allergies information. But right here under the assessment section, we have our ICD-9 codes. And right here under the plan section, we have our CPT codes laid out really nicely for you right there in that clinical note. Okay, so at this point, Michelle has been seen by the doctor. Now she's ready to check out. So we're actually going to hop back into the practice management because now Michelle is back at the front desk with the office staff. In order to check out the patient, all the office staff has to do is click on that same appointment window that they used to check in. Only this time, you can go to the billing tab. So in the billing tab, you see those ICD-9 codes and CPT codes that were entered into the EHR app, and they're populating right here for the office staff to see. So the office staff is going to know exactly what they need to charge that patient for. You can enter in more codes from this screen as well, and if you need to enter modifiers or anything like that, you can do it from here again. Another thing you can do from this window is generate a patient super bill. The great thing about super bills in drchrono is that they actually have line item posting. So they show you a breakdown and show the patient a breakdown of exactly what they've paid. And I'll go ahead and show you what it looks like. From my perspective as a patient, this is really helpful. A lot of times I'll go into a doctor's office and pay maybe $20 right up front, but then I'll get a bill in the mail a few weeks later for another $30, and I'm confused as to why I'm being charged more. But the line item posting in the super bill is really helpful for the patients because it's so transparent and they all understand why they're being charged more. Hopefully that will also help you get paid quicker, because if the patient understands why they're being billed, they'll be more readily willing to pay. Also from this window, you can generate a HCFA form. There's actually two different types of HCFAs in drchrono. You can get the HCFA form with the HCFA and the text itself. So it would look like this, the complete form. So you have the red and the black writing, all of that information right there. Or if you wanted to, you could click on this other box right here and you would just get the text. The reason we have both options is a lot of doctors' offices have hundreds and hundreds of those blank HCFA forms laying around, and it would be a waste of paper if they couldn't print on them. So we give you the option to save trees. You can also generate a printer-friendly version of your clinical note right there. So if you bill workers' comp and need to attach that to your HCFA, you can easily print it out from this screen. Now this is where you go to submit that claim to the insurance company. In order to do that through drchrono, it's very simple. All you need to do is go to this billing status and choose on the drop down right here. You can choose bill insurance. Then you go ahead and enter in the patient payment, so maybe it's like $20. You can enter in their method of payment, so maybe they're paying with credit card, you can choose that. If there's a payer pre-authorization number, you can enter it there. And then all you have to do is hit save and close. And once you do that, that claim has already started on the submission process. The way it works in drchrono is first you submit your claim through us, and it goes to our in-house scrubbing system. If it passes our in-house scrubbing system, then your claim goes on to MDON, which is the clearinghouse we use, and they scrub your claim as well. If your claim passes MDON, then it goes on to the insurance companies and you'll get paid, and your ERA will post in your drchrono account. Throughout this process, you can track the status of your claim in our billing tab if you go to the live claims feed. So the live claims feed, which you see right here, shows all of your claims. They're all laid out right here. When you get paid by the insurance company, all you need to do to see it is you can click on that live claims feed and you're going to see a line item posting. So you'll know exactly what you've been paid. So you'll see a breakdown of all of your ICD-9 codes and your CPT codes, and you'll see the breakdown of those procedure codes. So it's really easy to understand what you're getting paid for what. So you'll see what was billed, allowed, the adjustment, what the insurance paid, the patient paid, the balances, and the status for each and every claim. So it definitely makes it easy to keep track of that information. In addition to this live claims feed, we have a lot of other features in our billing center, and I want to show them to you. But before we do that, I do want to tell you a little bit more about the billing process. You can see right here we have a claims status right here. If for whatever reason your claim has been denied throughout the process, either by our scrubbing system or by MDON, we're going to notify you as to why, so that you can fix it and resubmit the claim for payment before it gets sent on to the insurance companies. Also, if the insurance company you're billing to does not accept electronic claims, that's okay. We'll actually just drop the claim down to paper for you, so you don't need to worry about your postage. What'll happen instead is we'll just drop it down once it passes MDON, and then we'll mail it into the insurance companies. The only difference for you is you'll receive an EOB in the snail mail and you'll have to post it to your account, but that's fairly easy to do. So all of the analytics of all of your claims are going to populate in your billing center and give you a lot of data. And you can see we've got all of these reports over here on the left-hand side. The first one is a billing summary report. So this just shows you information about your practice. You get income analysis, average payment speed, performance indicators, all that type of information that you could want about your practice, overall general information. We have a patient payments page as well. So this is where you can go to enter in patient payments. So you'd click on it, you could choose your patient, so maybe we want to choose Jay Leno. You can go in and see the account balance for the patient, their unallocated balance, their totals, how much was allocated, how much was unallocated. And you can also go down here to enter in those payments. So you just automatically, the date's going to populate. You can choose the payment type. You can make note about the payment and choose the payment amount. So you can easily keep track of your patient's payments. If they owe you money, if they have credit to your account, it'll all be documented here. We also have a day sheet. So in the day sheet, this can be filtered by date or date range, or you can filter it by office or by patient. And like most of the documents or most of the analytics in the drchrono billing center, you can export it to a CSV file if you need to do that for any other bookkeeping in your practice. So this is going to give you the date posted, who the patient was, when the appointment was, who the provider was, and your grand totals of debit, credit, adjustment, copay cash, copay method, notes about it. You can get that for your credits and adjustments, your cash payments, and your charges. So it's really going to help you out figuring out on a day-by-day basis how your practice is doing. We also have a transactions page. So the transactions page can also be filtered by date or date range or by patient, and you can always export that to a file. So this is going to give you a breakdown of when the appointment was, who the patient was, who the provider is, and your grand totals of what was billed, adjustment, what the insurance paid, patient date, when the date was posted, and any notes about the appointment. We also have a remittance report section. In the remittance report section, you're going to get your ERAs. So not only are they going to post in that line item area that I showed you, but you're going to get an ERA that looks like a ticket, and it's going to look a lot like this. So you can see they'll all be there. You'll have the ID number, the trace number, when it was received, when the appointment was, who the patient was, what insurance company it was it rejected or not, how much was billed, how much was paid, what the patient responsibilities, and what is going to be paid to the patient. So all of that will be in your remittance report section. In addition to that, we have this accounts receivable report. So here you can see we have this graph that you'll get. You can see it broken down into buckets. So you can also view this by insurance, and you can see a breakdown of the different insurance providers in the buckets: 0 to 30 days, 31 to 60 days, 61 to 90, 91 to 120, 121 plus, and your grand totals. But it can also be broken down by patient. So either view you can get different types of data. So you can see all of your patients and their information down in those same buckets. So you'll know all of your grand totals for different periods of time. We also have a patient statements page. This is actually just another place you can go to generate those same super bills. So you can get that super bill from that appointment pop-up window that I showed you, or by going to this patient statements page. Also, we have a product and procedure report. This can be filtered by your codes or by dates, and it's going to give you a description of all of your codes, and then the totals of how many times you've used that code, and your average charges, what the average insurance payment is, average patient payment, and the average adjustment payment for all of your codes. So you can really keep track on it that way. And again, it can always be exported. We have a patient balance ledger tab as well. So here you can go in and you can search by patient. So let's choose like Annie Hall. I am a Woody Allen fan. So we can go in and you'll see this information. You'll see who was responsible, so you'll get your payer ID, you'll find the name of the payer, and then your grand totals broken down into 0 to 30 days, 31 to 60 days, 61 to 90, 90 to 120, 121 plus, and your totals. So you can see all this information about the visit, the code, all of this information, what the insurance is responsible, the patient is responsible, what was paid, the balances, all broken down for you really neatly in this tab. We also have a sales tax section of our billing center. This is really great if you sell retail. So you can go here and we'll keep track of any of the retail you sell or anything that's taxable. You can always export this to file as well, so if you need that for your end of the year purposes for your business, you can certainly do that.
Is it telling you that?
We also have a fee scheduler. So the fee scheduler is where you go to enter the prices for your codes.
Is it saying
You can go ahead and enter the code once right there at the top. You can choose the code type, enter in the base price for that code, and if you want to differentiate by payer ID, you can enter that in there. You can also add a custom description for your codes. So if that way, if you want to search for them in a different manner than by the typical description or by the code itself, you could search for it then by that custom description. And then you just need to add it to your list. You will need to add the prices for all of your codes one time, but once you've added it once, it'll be saved into the system for you. We also have a balance billing tab at the very end of our billing center. So this is mainly for your out-of-network insurance providers. You can go in, enter in the payer ID, click True if you want to balance that billing tab, and add that to the system. So you can easily choose that and keep track of your out-of-network insurance companies. So in addition to all of these tools we have in our billing center, there are a couple other features that can really help you out, and I just want to show them to you really quickly. They're in our billing tab at the very top. If you go over here to coding, we have a code search option. So this is actually going to enable you to search for all of your ICD-9 codes, your CPT codes, any type of code. You can go up here and choose the type of code you want to search for and enter it there. So if you need to look anything up, this is the place to go. We have a very similar tool for a payer search, actually. So if you want to do this same search but look for all of the payer IDs, you can go here. We have over 3,000 payer IDs in our system to search from, and they are all of the major networks and most of the smaller networks in the country as well. Finally, the last thing I just want to show you is our new custom procedure section. This kind of relates to the tax section because if you want to add a retail product, this is where you would do it. You can go here to add a retail item that you sell or a custom procedure that your office offers. So it's automatically going to be assigned a 5-digit numerical code at the very top. Then you can go in and enter in the quantity, and you can make a description. So then this product or this procedure will be searchable by the 5-digit numerical code or by the description you entered. Then you can go ahead and fill out the rest of the information, make any notes. You can choose if sales tax is applicable, and if it is, you can check that. Then you can enter in the price either with or without cost. If it's a procedure with a specific duration, you can choose that there. And at the very bottom, this is where you differentiate if it's a service or a product, and then save it to the system. Once you've added it, it's always going to be in there, and you can add it to a patient's super bill or a patient's chart. So you'll easily be able to either bill for it or document it within the center. Alright, so that is actually pretty much it in terms of our billing center. Thank you so much for attending the demo.